My name's Gartner. I'm a senior here at MaCmurray. My topic for my research project was mental health and Medicaid, and I was looking at what's available and the outcomes of this. For the introduction, parents with mental illness diagnosis involved with the child welfare system do not have affordable medical accessibility. The purpose of this research is to access the connection between inaccurate, accessible medical attention and the termination of parental rights. For my lit review, I found approximately 65% of mentally ill individuals are mothers and 52% are fathers. As an Illinois resident, when a client becomes involved with the child welfare system, they lose their child's placed in foster care. When this happens, they also lose their medical card. With the removal of publicly funded medical care, clients do not have the access to services needed to obtain mental health treatment, especially medicine, while trying to improve their mental illness. My methods for this research project were non-experimental. I used clinical records and agency records. Information for my research was obtained through Hobby Horse House of Jacksonville, the local child welfare agency. Access was given through the supervision of Executive Director Lacey Brandon to access the 9 clients' records. Data collected was coded and analyzed using Microsoft Excel supervised by Dr. Jill Scalacci. My findings. My first finding was without the medical card, most of the mental health clients, 88%, were not able to take medicine even if they had a job or collected government benefits because they cannot financially afford it. The second finding was in all cases of termination of parental rights, this was 77% of the sample, the clients did not have a medical card. The conclusion of my research included parents with mental illness have a hard time making progress with their mental diagnosis because of their lack of access to proper medical treatment. Unfortunately, this results in termination of parental rights. Future research. As of January 1st, 2014, millions of low-income parents and other adults will become newly eligible for coverage in Illinois under the Affordable Care Act. Expansion of Medicaid to adults with incomes at or below 138% of the federal poverty level. With this, I look forward to seeing how this will help my future clients and how it will affect the family and the individual themselves. Any questions?
I have a question. Why is it that they lose the medical card?
Because the children are not in the household, so the medical card is for the children, and then they get that privilege taken away from them.
So an adult can't just go and get it on their own?
Not when they're involved with the child welfare system.
Any other questions for Dawn? Great, thank you.